Looks like we've got a good crew that's signing in here. Again, for those of you that are just joining us, welcome to the TPEA sponsored long-term care lunch and learn. I'm John Green on behalf of TPEA and AMBA, as well as Deanna Bockham with us, sales manager from AMBA. We'll be sharing with you a little bit about long-term care, how it coordinates with your state benefits, some myths and things like that. For those of you that just jumped on, you'll note that QR code down there at the bottom. You'll want to hover over that with your camera phone, just like you do menus at restaurants today, and it'll take you to a place where you can do one of two things, or both. You can fill in your information there, get entered into our drawing for Amazon gift card that TPEA is giving away, and throughout the presentation, if you've got a question, feel free to answer that, ask that question on there, or to select, hey, review my benefits, have somebody call me. This is such a personal situation with long-term care. We want to make sure that everyone gets heard. Also in the chat feature, Deanna is going to be monitoring that. If you have some questions about long-term care that you want to ask that the group could benefit from, we can go along and start that as well. Again, my name is John Green. Welcome aboard. Let's go ahead and get started. We're glad that you're here. Before we jump in and talk about long-term care, we want to hit a little bit about who the TPEA is. Just a quick reminder of TPEA. The Texas Public Employees Association has been around for a long time, and they're there to protect, first and foremost, your defined benefit pension plan, making sure that whenever you retire from the state, you have the money that you expect coming to you. They're also designed to get as much funding out there for your staff, for your team, as well as give you access to benefits and discounts and protect the benefits that the state provides for you as well. AMBA, Association Member Benefits Advisors, is the partner organization that partners alongside with TPEA to bring you best-in-class benefits, benefits that you can't get within the state, that there are gaps that you have in there, also fun stuff, travel discounts, things like that, and benefits that you may get or that you may need when you leave state employment for whatever reason, that type of thing. So the number one priority that we have at AMBA is to make sure that we give members to TPEA. If you're not already a member of TPEA, you can join for $7.50 a month if you're an active state employee, $2.50 a month for state retirees, and if you're a spouse of an employee or you just want to have access to these benefits and you're not a state employee, then you can have a membership in TPEA for $2.50 a month. And that brings you not only the benefits and the fun stuff, it also, more importantly, brings you legislative action. Legislative things and notifications of top bills out there that impact your pay, your pension, and your benefits. And that's exactly what TPEA does. These are just a couple of examples of the benefits that TPEA provides to their members or makes available to their members. They fill those gaps. They're portable when you leave for any reason. You can extend these benefits to adult children, to parents who aren't eligible for your state benefits. And especially when we talk about long-term care today, having this long-term care benefit on your parents may prevent you from having to taking extended time off to take care of your loved one and therefore eating up all of your PTO and having to spend money out of your pocket for where pay was missing. We're going to hit real specifically today on this whole nature of home health care insurance. Home health care insurance is a very broad definition, covers a lot of things such as long-term care, which you've heard of, short-term care, recovery care, hospital indemnity. A lot of different things out there fall under this home health care coverage. And so we're going to hit on quite a few of those today in a pretty rapid fire method during this lunch and learn session, cover you at a high level. Again, as we mentioned, whenever you see the QR code down there at the bottom, if you've got questions, you can scan that just like you would a restaurant menu with your camera phone, and then you can ask those questions. We can have someone call you, contact you individually about it. I wanted to show you this page very specifically. This is the second page of your ERS benefits website. The state provides you with some very good benefits. You know, a lot of folks like working for the state because as a state employee, you get free medical coverage. They also provide you dental insurance, access to vision, life, voluntary accidental death and dismemberment, disability, short-term and long-term disability. They used to provide, the state used to provide long-term care insurance. No longer does the state provide that coverage. It's a very difficult product on a group basis to acquire. The good news is through the TPEA, You have some individual options with you. We're going to cover those today. But long-term care was thought of at one time to be an extremely important component of your benefit package. It just got unwieldy and expensive at the state level to offer it to all employees. Thankfully, the TPEA has picked up the gap on that. We're going to talk about that as we roll through here. Again, you'll see the QR code. Don't forget to scan that, enter into our drawing first and foremost, and if you've got questions, we can answer those as well. I want to do a quick quiz for you. True or false? Just write this down. If you want to write, number your paper 1 through 6, and you can answer these questions in your head. True or false? Long-term disability and long-term care are the same thing. True or false? Very few people need extended long-term care. True or false? Only people over 50 need long-term care. True or false? Nursing home confinement is the only long-term care option. True or false? Medicare will pay for everything. True or false? I should wait to decide until I'm retired. And I can tell you, if you've written down anything other than false on this, false is the answer for every one of these. And we're going to talk about these as we go out throughout this presentation and just address some of the myths, the concerns about long-term care, what people think is covered, what's not covered, and the myriad of options that are out there. That's the best news of all that we're going to cover on this presentation today. The truth is, over 70% of people over the age of 65 will need extended care at some point in their life. And that extended care doesn't have to mean that they will have care all the way through their lifetime. It may mean that as a result of an accident or the result of a surgery, they have to have extended care that falls outside of their medical plan. And so when we're talking about long-term care, we're not talking about just that inpatient, outpatient surgery, maybe 1, 2, 3, 4 days in the hospital. We're talking anything over that. And there are a lot of different options that are out there, some that are covered by your medical plan, most that aren't, and then what the TPEA solutions that are offered out there. Again, feel free, if you've got questions, put them in chat. Look at that barcode or the QR code when we get a chance to do that. And when we talk about extended care can be care in your home, it can be care in a nursing home or a long-term care facility, or it can be care in these, what I call assisted living communities. The nice thing about the manner in which care is provided in this extended environment these days is it doesn't always have to be just in a nursing home. There are many of these extended or these assisted living communities where you may start in a community where you totally take care of yourself. And then as you need more care, you've got that there. You can move into different wings, things like that. So extended care is a lot of different things. So when you hear that term, it's pretty broad in terms of what we're talking about. But how you pay for extended care is pretty broad as well. First and foremost, most people use their personal savings or assets. And what I find a little distressing is that you can save all of your life for your anticipated retirement. You get your pension plan from the state or whatever your retirement plan is. And then you or your spouse has to go into a nursing facility or have some type of long-term care, and you spend down a significant portion of those savings that you had out there. The second way that folks pay for extended care is they have to ask a family member to take off from their job or to quit their career and receive care from a friend or a family member or move into a family member's house. Some people choose to enter the Medicaid program. We'll talk a little bit about Medicaid. We'll talk about how that works. Or some people have the ability and pay for it through extended care coverage. And we're going to talk most in depth about extended care coverage. Lots of different ways to pay for extended care. Some of them more painful than others. Some of them are really, folks are really glad they have it when they've got it. Again, if you see that QR code, feel free to jump in. We've got some entries already into our drawing, or if you want to have someone talk to you about it. No one knows what the future holds in store. Most people think the older I get, I may need it. But what you find out is accidents and injuries, even when you're young, can cause the need for long-term care services as well. Hospitals are rewarded by moving patients through the system quickly. And that means that a lot of times rehab and other things are done at home, or there needs somebody to be at home that maybe as a patient you can't take care of certain things and you just need somebody to come sit with you. There's that as well. So just because we think of this as a long-term and older situation Not necessarily so, but you never know at what age you're going to need it in your life. One of the common myths, or some of the common myths about long-term care, is that health insurance will cover all your long-term care services. And that's a big myth. As the state, as different companies, as they look for insurance ways to save money, there are different things that are cutting down the number of hospital stays or the length of hospital stays. The other concern is, or the other myth especially, is that Medicare will cover all your long-term care costs. And that's absolutely not true, because Medicare is not the same thing as Medicaid. Two big misnomers there. And then the one thing, the biggest common myth that we see out there is people think, I've got to wait till I retire, till I purchase some type of long-term or short-term care program. And that's not true as well. That's a myth that you can never be too young to buy this. There are certain ages for certain products, but the savings and the qualifications are significant. We'll show you that in a moment, and may make it wise to do that now, to take care of it before there's a potential need in the future. Again, we kind of touched on this earlier. Long-term care does not mean necessarily having to be confined to a nursing home. The biggest trend that we've seen in this over the past 30 years is that more and more people want to spend their recovery time or their last several years at home in a comfortable environment where they grew up. It's their home. They don't want to go to a nursing home, especially in this coronavirus environment. The last place some people want to go is into a nursing home facility. With long-term care insurance or short-term care or recovery care, you get to pick where you want to go. You can stay at home. You can go to a community, like I mentioned, these progressive care communities over a period of time. You can go into an assisted living facility that has, again, graduated levels of care, or if need be, where you need a constant round-the-clock care. Nursing home facilities, there are all different levels of nursing home facilities as well. So these services are provided in a bunch of different places, and with the proper planning, you can decide where you want to be taken care of. And that's what's most important of all. I never want to see someone work all their life and then have somebody else determine how their care is provided for. And with a proper long-term care plan that Deanne and her team can put together for you, you can make sure that you take care of how you're going to live out those years that you want to. This is just an example that Mutual of Omaha, one of our best companies, one of the companies that's probably been in the long-term care business the longest, shows a national cost of care survey. A home health care aide is around $25 per hour to come out to your house. To live in an assisted living facility, a single occupancy, about $6,000 a month. In a semi-private room, it can run over $100,000 a year. And in a private room in a nursing home, $120,000+ a year. My father, the last 2 years of his life, spent it in a semi-private room in a nursing home out in Marble Falls. It was a nice facility. It was not the Taj Mahal. He received constant care, very well taken care of. It was over $6,000 a month. And I'm very thankful that we had a long-term care policy on him. My stepmother could not have paid for that coverage at all, could not have paid for that out of her pocket. So you can see the cost of care here. It's significant. As we as Americans age, there's more demand for these services and more people that qualify for these services. And so the cost is going up. It's not something that's easily, inexpensively taken care of. But thank goodness the TPEA has a lot of different ways that you can take care of that coverage that you need. Again, we talked about payment. I talked about how my stepmother and father were able to pay for his care. You can use your savings, but a lot of times our savings is wrapped up in some form of a 401k or a pension plan where you're getting a defined benefit every month, or it's in tax areas, or it's in your home or land or some type of asset that you can't sell. And so the funds may not be there as liquid as possible. And you have to do some things that you may not have planned in terms of taxes, in terms of your assets, and want to pass them on to your grandkids, your kids, things like that. So again, there's some impact there. Some folks say, well, I'll just spend all my money down or give it all away to somebody else and rely on Medicaid. A couple of things I want to point out on there. That truly is a last resort program designed for people with limited assets. You have to be very specific well in advance of spending down your assets to qualify, and no one that I know of would want to basically put themselves in the poorhouse in advance of not knowing whether you need long-term care or not. And one thing that I've noticed the past couple of years, states have been extremely aggressive in getting reimbursement back from your estate from paying for those Medicaid benefits. So again, you might think that, hey, it's great, I could spend it down, go to a Medicaid program, and then you pass away, and all of a sudden they knock on your spouse's or your widow's or your family's door and say, hey, we want you to pay us back all that money that's in there. Also, I noticed whenever I was in my father's facility out in Marble Falls, there were 3 wings to his facility. The facility, the wing where he stayed, was private payer because of his insurance program. It had many more nurses, many higher level of care. The Medicaid wing didn't have as high of level of care, not as many nurses. Again, you get what you pay for in this arena. And so making sure that you've got the ability to pay and the way to pay for it is extremely important. The solution is, if you don't want to spend down your own savings, your retirement savings, you don't have access to those monies, you don't want to go on the Medicaid program, there are many types of long-term care programs out there. They can supplement your out-of-pocket expenses. They can protect your assets and keep you from having to spend it down so that your spouse that lives at home can still maintain their standard of living, or can keep you at home and keep you connected to those things that matter the most and not having to worry about your income there. The stay-at-home benefits of any type of long-term care plan, recovery care plan, short-term care plan, those are the most crucial things to me. The stay-at-home benefits, to be able to say, I want to keep, and we kept my father at home for a couple of years because of this, before he had to have different type of care. Household tasks like cleaning and meal prep, bathing, getting dressed, things like that, allows for a family member to come in and take care of you, and then a visiting nurse to come by, or a home health aide to administer medications, things like that. The proper type of plan can provide special equipment like walkers, wheelchairs, and they can modify your home, be used to say, let's put in some wheelchair ramps, let's put in some pull bars in the bathroom, things like that. If those things can modify your home and keep you at home, wouldn't you rather live at home than have to go into a nursing home facility? So again, this is an opportunity that you have, that you can use this long-term care insurance or these plans here. There's 2 types of benefits. I've been dealing with long-term care insurance for almost 30 years now. And in the past, it used to be, it was on a reimbursement or a per day basis, meaning that you had to start into a facility, you had to go through an elimination period, and then as you actually spent the money, you get reimbursed for it. These days, there are many different plans out there. Some have no elimination period, meaning no deductible, a very similar situation where you can receive benefits immediately, or you can shorten it down to however much savings you think you want to spend out of your pocket. And then also, they can come into you in the form of cash. Whenever you qualify, you get a lump sum of cash to determine what you want, or you can get a monthly payment to determine what type of care you want. You can still get the reimbursement side as well. You can do percentages. You can do up to specified amounts. There's so many different ways which Deanna and her team can design a program for you. It's so important that you understand it and understand how it can impact you on a personal level, and so many things that can fit your budget. That's the nice side about what the current state of long-term care insurance is today. The biggest thing that I see, and the biggest frustration that I see in this, is that folks wait until it's too late. They wait till they retire and decide, hey, now I need to get long-term care. They wait until they go home for Christmas or Thanksgiving and they see somebody that says, hey, we need to take care of grandma. We need to take care of Aunt Edith. Well, who's going to take her into our home? I don't have the ability, that kind of stuff like that. We need to get her long-term care insurance. Well, she's in her late 70s. She may not qualify anymore. You see here these data facts out here that show the longer you wait, the harder it is for somebody to qualify. And again, you see the QR code down there if you want to jump in and enter into our drawing. If you want to get some questions, somebody to talk specifically about that kind of stuff, we can help you do that. And the longer you wait, as well as it harder to qualify, the cost of waiting is significant as well. It can cost you thousands of dollars more to wait to purchase long-term care insurance. Much less expensive. The younger you are, the easier it is to qualify for. And in the long run, you've got peace of mind knowing that you don't have to worry about something happening if you get into an accident or you've got some other health related issues younger than what you anticipate. Deanna, I see we've had several questions come in. You want to answer a few questions before we move on?
Yes. Like one of the questions came in on the free look period, how far back? Is it 5 years or 7 years? My belief that it's still 5 years. The question is will you qualify for Medicaid anyway with having a pension plan? If you work all the way through your time with the state and you have that pension plan, it's going to be very hard to qualify for Medicaid. You may be able to get some assistance, but they're going to 100% take your pension check first, because my dad is a retired state employee, or was a retired state employee, and there was no assistance or help for him just because of that pension plan. The biggest thing about the 5-year look period is, when do you prepare for it? How do you know, because you never know when something's going to happen for you. So it's really hard to prepare for that anyway. And that was really most of the questions on it. Do I need to worry about the free look period? Can I start working on that free look period? Those kind of things.
Great. That's correct. I mean, you see that. You see a lot of commercials out there. You see people say, hey, that's a great little trick to do that kind of thing. And Deanna hit on 2 points. With a state pension, real hard to qualify for any type of Medicaid-based program. And with that 5-year look-back period, if you're planning that far in advance, you might as well do something to take care of it and get the type of care that you want or that you want your parent to have, things like that. Speaking of parents, we see a lot of families, and this is what my brother and I did whenever my dad was in his early 60s. We got together and said, we need to get him a plan. He was totally healthy. We just figured he was on the road a lot. He was a traveling salesman. He needed to get a plan. And so we got him a plan, as my brother and I did. Best investment that we made there. So again, you don't have to necessarily buy long-term care on yourself. You can get it on your parents. Again, you can get it on yourself as well. These plans that Deanna and I have talked about are only available to TPEA members. As an endorsed benefit that the TPEA has looked these over, researched them, and says this is the type of benefit that we want to bring to TPEA members, people who understand the need for this. We're here to help you. You see my phone number down there. You see my email down there. Would love for you to put the QR code on there. Scan that, at least enter into our drawing that we'll hold after we close the session down. We'll notify those who win. But if you've got questions about benefits, if you want to talk about that look back period, the Medicaid options, all those kind of things, it's so crucial to understand this. And there's so many different programs out there. One of my favorites, and again, we don't have a ton of time, but that we haven't talked about, is a short-term care program. And I'll share why I like it, and then I want Deanna to just kind of touch on some highlights of that short-term care. I've saved up all my life and might say, I don't want to go into a nursing home. I want to maybe get a long-term care plan with a large elimination period. And a short-term care plan can be that stopgap in there. It's a less expensive plan. It pays for a specified period of time, and I can cover myself and my wife pretty easily and inexpensively. And I know that I've got a significant amount of money that if something happens to me, I've got at least a year's worth of coverage to get my financial house in order to maybe then start to prepare for long-term care. Deanna, why are you seeing most folks look at that short-term care option?
I think one of the main reasons is that if we do have something happen to us, we want to stay home as long as possible. And so the short-term home health care program that's got a 0-day elimination is absolutely perfect for that. Also, with your insurance or Medicare and things like that, they're not going to pay for custodial care, for skilled care. And so if you have a hip surgery or a knee surgery or something like that, and some of us have that at a younger age, it's nice to know that you can have someone come into the home, even if it's just to go grocery shopping for you or clean the house. So they're just very, very popular. And you can get enough coverage that you would get the same amount in 1 year that you would have got on a traditional long-term care over a 3-year period. So you are in control of your own finances. You're in control of how long that lasts for you. That's what's really great about those. And we need to get out of our mind that it's not really short-term care, because it can, you know, if you're getting $108,000 in a year, that can extend out for 2 to 3 years easily. The thing about it, the thing I like most about it, again, I told you, is that there's a 0-day elimination. With long-term care, they do not offer less than a 90-day right now. 90 days could be $9,000 to $12,000 out of pocket for you. And so it's important that even if you want the traditional one that lasts 4, 5, 6 years, that you get the short-term care that covers that first 90 days at least. So if you've already got a long-term care in place, you know, that's great. I've had one since I was 37. I've been planning on it for 23 years now. But you want to also cover those deductibles and out-of-pocket expenses so you're covered right away.
Great. Thank you very much. And Deanna really puts a good bow on it. Long-term care is what we have in our minds. Really, it's about the manner in which you want to be cared for whenever you need it. And the TPEA has done a wonderful job partnering with AMBA to make sure we've got the proper endorsed benefits, the proper coverage that coordinates with your state health benefits, covers those gaps. And then whenever you need something, you've got the ability, you've got that income out there that if you need to, you want to stay at home, if you want to take your mother in, whatever your need is, or that you have to finally ultimately go to a nursing home facility because you need the type of care, the skilled nursing care 24/7. You've got that coverage there. You've got that peace of mind. So I encourage you, write down our phone number there, my email address, scan that QR code. We've got several of you in the drawing right now. If you want to jump in the drawing, this will be your last chance to do that. And then, you know, you have an opportunity down there to check, yes, review my benefits, and we can have someone on Deanna's team give you a call. So I'll open it up for any last questions before we sign off here. I appreciate you letting us spend this December Monday afternoon lunchtime with us. So any questions out there? Okay, thank you very much. We appreciate you. Have a great Christmas. Again, scan this QR code. We'll leave that up for a few more minutes, but we'll sign off for now. And we will be glad to answer your questions offline. And then we'll be calling the winner of the drawing. Thank you all very much. Deanna, is there any other questions that have popped in?
No, that's it.
Okay. All right. And we will be...
Wait, I'm sorry, there is. Someone wanted to know if they could review the recording later. They noticed that you were recording it.
We are recording this. We'll find out the process to get it onto the TPEA website, and TPEA will make sure that it's available to us. So that's a great question. So we're starting to do this series, and TPEA has been really good about wanting to put together a series of webinars on hot button issues, everything from child care to long-term care and everything in between. So we'll make sure there's a process out there for that. So thank you very much. All right, folks, have a great, wonderful week and a great holiday season. At TPEA and AMBA, we do appreciate you and look forward to serving you in the future. Thank you.